In this 5 minute med audio for anti-anginal drugs, I'm going to really focus on the three key classes of medications: nitrates, beta blockers, and calcium channel blockers. Um, just to give you a background of pathophysiology of cardiac diseases, you probably are aware that when there's a blockage in the coronary arteries, there is a need for opening of the blood vessels to immediately improve the blood supply so that the pain, of course, and then ischemia of the cardiac cells can be prevented. As you're aware, there are many types of angina, stable and unstable variant. Without going into much detail, I would like to focus first on the vasodilators, which are the nitrates. So the nitrates or nitrites are compounds that can potentially cause quick vasodilation. So that's why these are used in an episode of sudden cardiac event like, stable or, angina. So if you think of a person having chest pain, severe crushing mid-sternal pain that might be radiating to the jaw or the left shoulder in men, compared to women who might have very specific pain, for example, GI like symptoms or back pain or left foot pain, we call it, there's a need to open up the cardiac artery. So nitrates are useful to open up this, and they're available in many forms: sublingual, patches, and sprays, and they're also available as ointments. They can also be given IV drip. So if you think of dilating the coronary arteries as a main mechanism and causing vasodilation, that thereby relaxing the smooth cardiac muscle cells, this can prevent angina. So the reason these are given is, of course, to save some time to get into the hospital setting, ideally, or to prevent another MI after a recent myocardial infarction. Since they open up the airways, they open up the cardiac arteries, there are potentially some side effects such as reflex tachycardia, and headaches are very common, and sometimes postural hypotension. And eventually, when patients take it for a longer period of time, they could also develop tolerance. So something to keep in mind is to make sure, the tachycardia is addressed, and then the hypertension is addressed too when we are the nurse taking care of the patient. Other teaching to include when patients take this medication is to make sure they do not take more than a total of 3 tablets. And right after taking the one tablet, they need to call 911, and they should not be driving themselves to the hospital. They need help. So usually when they call 911, the medical operator, emergency person will guide them. So the directions are to take one tab every 5 minutes and not to chew, especially the sublingual form. You need to teach them to keep it below the tongue and then limit caffeine intake because of the risk for, tachycardia, hypotension, and also keep the medication in a dark glass bottle. Usually these expire, so they make sure they keep it, updating the prescription and keep it filled and keep it ready, particularly after having an episode of MI. Then we think of the beta blockers. There are many types of beta blockers: the beta 1 selective, beta 1 non selective, beta 2 blockers, or we call them, agonists and antagonists. To make it simple, for this class, we will just review beta blockers. Beta 1 blockers, particularly the ones that are second generation, they are very specific and cardioselective, meaning they target just the heart. Even though there are some side effects, medications such as metoprolol, atenolol, they're more specific to the cardiac smooth muscles, particularly in the SA node, where thereby they decrease the heart rate. Sorry, there's a typo here. Beta 1 blocker. And then decrease oxygen demand, because what happens is when the heart does not receive enough oxygen, it tries to beat faster, right? So we try to increase the oxygen delivery, and this is done by decreasing the contractility. So this contraction of the smooth muscles of the cardiac cells is happening fast. So we want to slow down the heart, thereby increasing the blood flow by effective contraction. So that's the goal. So some of the reasons a patient might be placed on beta blockers or post-MI for hypertension. Also, this is very commonly given. Beta blockers are very commonly given for cardiac dysrhythmias as well. So some of the side effects include, patients can have fatigue or bradycardia or hypertension and hyperglycemia. Sometimes there's still studies to find out why in some people they have hypoglycemia as well. But something to keep in mind in men, there could be some, challenges with lower libido with beta blockers, but not for everyone. So this is usually well tolerated, the beta blockers, and the suffix to remember here is the OLALs. The last class of anginal drugs are the calcium channel blockers. There are again different, categories under this, just like beta blockers, but for purposes of this class, I would expect you to know cardizem or diltiazem and amlodipine. And the way to know is that from your fluid electrolytes class, you probably know the action of calcium in terms of smooth muscles, right? So the smooth muscles are present in our skeletal, system, in the stomach, and also in the GI, and also in our heart. So if you think of calcium and we give calcium, there's a possibility that the contraction can be slower, right? So when there's slower contraction of these smooth muscles, they can cause vasodilation when you block them, right? So these calcium channel blockers, they're blocking the calcium channels, as simple it is, right? Thereby reducing the workload, thereby decreasing the oxygen demand. As you know, cells need oxygen, right, in order to process and work, right? So if you decrease the demand it needs, then the supply doesn't have to be that hard. So there's work done here from the calcium channel blockers to block these calcium channels, thereby helping with pain, chest pain, hypertension, or it should be AFib, okay? And then some of the side effects are hypertension, and they can cause some palpitations, bradycardia. Constipation is the main one, so encouraging patients to take adequate fluids.